Hello everyone. Today we are going to discuss about the newborn assessment and the normal newborn. So in this unit we are going to study about the newborn which is normal. All in normal cases how the newborn will be. So first we'll finish the normal newborn. In the next unit we'll study about the abnormal newborn and high risk newborn. And this topic already you have studied in your pediatric. So just we'll discuss, and if you have any doubts you can clarify with me. So in the terms we have some neonatology, that is the branch of pediatrics that deals with the disease and the care of newborns. So neonatology means it is a branch where we will be dealing with the pediatric, means related to child, okay, and the disease and the care of newborn. The neonatal period, it's the from the birth to the 28th day of life, means 4 weeks after the birth. That period is called as neonatal period. And we have one more term, that is perinatal period, from the 28th completed week of the gestation to the 7th day after the birth. This period is called as perinatal period, okay. From the 28th completed week of gestation means pregnancy, the pregnancy when it's completed 28th week of gestation, and even after the birth after 7 days we can consider it is a perinatal period. So these are the three terms which will get commonly in this unit. Next we have the terms like according to gestational age. There are three categories we can divide the baby, like full term baby or full term infant, preterm infant or post term infant. Full term means an infant born at a gestational age between the 37 and 42 completed weeks. You can see this picture. If you see the picture we can notice that the baby is looking healthy. So it means the baby is full term. The baby completed 37 weeks of gestation or pregnancy. Okay. Preterm infant, an infant that is born prior to 37 weeks of gestation, okay, 22 to 37 weeks, or weight greater than 500 gram. When the baby is delivered before the 37 weeks of gestation, in that case we will call it is preterm baby. Even you can see the picture that how it looks. Next we have post-term infants, that is an infant that is born after the 42 or 42 week of gestation. When the baby can born even after 37 weeks of completing gestation means pregnancy, then we will call it is a post-term pregnancy. In case of post-term pregnancy we can notice that baby will have their wrinkle in their body, okay. So this is the difference between the full term, preterm and the post-term infant. It is based on the gestational age. Gestational age means based on the pregnancy week. Next we have definition of normal newborn. A healthy infant born at between the 38 to 42 weeks should have an average birth weight for the country usually exceed 2.5 kg or 2005 gram. It cries immediately following the birth, establishes independent rhythmic respiration and quickly adapts to the changes environment. See, actually what happened, different country have different birth weight for normal. Like in India, if the baby weight is normally 2.5 kg, we can consider it is a normal, but for the foreign country it is different, okay. And even after, if the baby is completed 32 7 weeks of gestation, if the baby weight is 2.5 kg, and if baby cries immediately after the birth and established independent rhythmic respiration, it means without any support baby can take breath, and it quickly adapts to the change environment. What do you mean by that? Means without any like support, without any ventilation or warmer, baby can able to adjust with the this extra uterine life, then we can consider that baby is a normal newborn. Next we have physiologic adaptation, okay. Physiologic adaptation means the mechanics of birth is required a change in the newborn for survival outside the uterus. We know that the environment inside the uterus and environment outside the uterus is fully different. So immediately, like after the delivery, for the baby or for the newborn, it is like difficult to adjust with the extra uterine life. Respiratory gas exchange along with the circulatory modification must be occurred to sustain the extra uterine life during this time, as the newborn strive to attain the homeostasis. They also experience complex change in the major organ system. Although the transition usually takes place within the first 6 to 10 hours of life, many adaptation takes weeks to attain full maturity. So already I have told the environment, or the warmness or the comfortness what the baby will get inside the uterus, the outside uterus, it will be fully different. So for the baby it may take some time to adjust with the extra uterine life, and for all the major organ also. But within 6 to 10 hours of life, baby can survive or baby can adjust if the baby is born with full maturity. It means if the baby is born even after 37 weeks of gestation, okay, then the baby will be able to adjust with the physiologic adaptation. So today we have seen about the normal newborn, some terminologies, the definition and the physiologic adaptation. Thank you everyone.